Yeah, so the answer straightforwardly is John Connolly, Medicaid Director and Deputy Commissioner at DHS. The answer is straightforwardly yes. This is a new threat above and beyond the $2 billion associated with the withholding that they mentioned in the letter to the governor on January 6th. So we appealed that finding of noncompliance and that withholding. We're in that process currently, and that is playing out. While that's happening, they also initiated and they communicated in that letter on the 6th, they were starting a focused review of the 14 high-risk services in the program that we identified. And that review is underway now, and associated with that, what they're saying is, pending the receipt of information from the state to substantiate billing in those 14 services above and beyond the $2 billion in the withholding, they're now saying they're going to withhold, or rather defer. It's a deferral, different technical term, but basically defer payment in federal funds up to $260 million quarterly until we pass through this process. And so our concern is that this could go on for several quarters, which would be catastrophic for the Medicaid program, for children, for people with disabilities, for seniors, for hospitals, for rural Minnesotans, for nursing facilities. So the answer, we feel like this is no longer about fraud because we have been acting for well over a year and a half to fight fraud here in Minnesota. I think you all have reported on that. And we've substantiated a number of actions before CMS engaged us in December. So the claim that this is necessary to make sure that we're serious about fighting fraud is just not credible. And it took CMS a year to engage in earnest with us on that. So this feels just punitive at this point, rather than helping us fight the problem.
What is the latest on your estimate? How much fraud have you found, and how does that square with the Fed's estimates of $9 billion or more?
We have no evidence to substantiate at this point a $9 billion figure. So if there is evidence out there, and others have suggested at the federal level, there is that level of fraud in the program, we need evidence to be able to stop payment to bad actors right now. But we have no evidence to substantiate $9 billion.
Sorry, may I follow up? Ballpark, how much have you found?
So at this point, our investigations are still ongoing. What we found and what's been substantiated so far in legal proceedings, whether it be plea deals or in court proceedings, those are the numbers we're leaning on. The Star Tribune has published figures in that regard, but we don't have evidence to suggest that there are $9 billion in fraud in the program.
Could you comment about continuing to have the attention of the federal government? What do you think is behind this? Immigration action?
If I knew what went on in Donald Trump's mind, I think the world would be really glad to hear me say what it is. I have no damn idea, Mary, what they're thinking. This is, yeah, because I think the number is now 19 billion, according to the president. And, look, the thing about that is, and we've been very candid and open trying to solve this, misinformation doesn't help us fix fraud. Saying false numbers like this doesn't get to the reality of this, the actual tools to do it. Look, I see no other way to view this than I take him for his word when this is reckoning and retribution. They used false pretense to come in on Metro Surge, and we saw the catastrophic damage that was done and the deaths. Now we're seeing them turn to this. And again, I ask all of you, you're very versed at this. You followed this. You see this. So they're going to freeze the money because of fraud. What specific fraud? What did you see that the state didn't do? You've been hearing this. We've been doing all these. They gave you not one single grain of this happened that's fraud. And as we know, it doesn't make it right. This is in every state, and the numbers are bigger in other states because they're bigger, and they're doing nothing. And they're being very specific about this. And look, I don't know when sometimes somebody says that enough is enough. This is a targeted retribution against a state that the president doesn't like. The real shame in all this is a state that does health care as well as anybody. Health care outcomes, health care access, health care providers. We do it as well as anybody. And this Medicaid piece, I don't know how you can't use this statistic. CMS's own numbers say Medicaid error rates in Minnesota are 2.1%. National average is 6.4%. Why are you coming to a state with the lowest in this? And why did you make an arbitrary decision to, what's the word I'm using now they're calling this? A deferral. It's not. It's a ransom note. It's the same stuff they did. They sent that on January 6th of when they're threatening us, and then what they wanted, voter rolls, they wanted everything else. So look, I've asked the president, we're tackling this. We want to partner with you. We need you to quit firing U.S. attorneys who are good at fraud. We need you to quit firing FBI agents because they carried out their job. We need you to partner with us because I don't know why this is so hard to understand, and I will continue to say this. You can trust me on this. The person who's angriest about this fraud is me. There is certainly no political upside to having fraud in your state, and it undermines the very program that I have spent a lifetime advocating for and trying to implement, and we have got criminals. It seems like the Republicans, the only people they're not concerned about in this is the actual criminals, standing with the criminals. This president has pardoned people who took part in Medicaid fraud, who were responsible for paying back almost $300 million, and because he pardoned them, that went away. This is some type of upside-down world where we need the adults in the room, and I'm counting on Republican leadership here in the legislature to say, we're going to give them the tools to put people in jail who commit fraud. That would be a great thing. So, Mary, I can't answer you.